The smoke from the historic West Coast wildfires are causing serious health concerns for those living nearby, but also for people living thousands of miles away. All of this as we continue to deal with a pandemic that affects our respiratory system, which brings up the question, does the smoke make us more vulnerable to COVID? So Dr. Kohli joins us with answers. Hello, Doc. It's good to see you. We have viewers watching who don't live anywhere close to these wildfires. Should they still be concerned? And what are the effects of the smoke pollution?
Tori, they should be concerned because NASA satellite images have actually shown that the wildfires from California have traveled as far as 600 miles away off the coast of California. And these wildfires, unfortunately, have both short-term and long-term health effects. So in the short term, we've all experienced these, the burning of the eyes, the throat, the nose, the irritation in the lungs. But in the long term, they can actually increase your risk for heart disease, early onset dementia, they can cause premature aging of the lungs, and they can cause certain types of cancers.
Oh my, wow.
Doc, are people who live close to the wildfires more vulnerable to COVID-19, and would wearing a mask help? I'm no doctor, but I'm going to roll the dice on this second question and say yes. But I'm going to pass it to the doctor.
Genius.
So let's talk about this, Jeff. This is a really important question. And the answer to your first question is yes. People exposed to wildfire smoke have a higher risk of infection from COVID-19. And the reason is because the pollutants from the smoke actually distract your immune system. So it's busy fighting the pollutants and it's not as good at fighting the virus. So they can increase your risk. But the opposite is also true, which you may not have known, is that those people who've had COVID actually have an increased susceptibility to risk from the wildfires. But the mask question is kind of interesting because it's a little counterintuitive. So masks certainly protect you from risk of COVID, but when it comes to the wildfires, they just don't filter out enough of those pollutants. So the only type of mask that really does protect against wildfires is that N95. So I would encourage you guys to buy one if you don't have one already.
That's why I'm not a doctor. I was wrong. I was completely wrong. I rolled the dice, snake eyes. I was wrong.
And it's a 50-50 chance. It doesn't matter. Speaking of masks, we're switching gears here to talk about a new study out of the University of California, San Francisco. Researchers say they can draw a connection between people with COVID-19 who become severely ill and whether or not they wore a mask. Doc, we've talked about wearing a mask to protect others, but now it sounds like wearing a mask is also protecting yourself, even if you still catch the virus. Is that right?
Absolutely. And so if you didn't have enough reasons before, this is a great reason now. And the idea here, you guys, is the viral dose or the viral inoculum. So not only does it protect you from catching the virus, if you do get exposed to the virus, less of it gets into your lungs, and so you're less likely to get sick. And in fact, these researchers actually think that this may be the reason the mortality rate is going down from COVID, because people are wearing masks, so they're getting, less dose of the virus, and so they're getting less sick from it.
I have to be super honest with you. I tried to find an N95 mask, and it is finding like the Indiana Jones Holy Grail. I can't find an N95 to save my life. So
could you look at it like Indiana Jones, or you can't?
I can't see. It's too bright.
Remember the ghosts coming out?
You chose wisely. Remember that?
Tori, I'm going to hook you up because I've got a stash.
Ooh.
Yes. I love being friends with the doctor. All right, thank you so much. You will be back tomorrow, so if you have a question about coronavirus you want answered by Dr. Kohli, write us on social media or email info@dailyblastlive.com.